Good morning. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. An additional probable case of COVID-19 has been identified. The newest probable positive case is a man in his 50s who lives in Winnipeg. At this time, the public health investigation indicates that this case is related to travel. In addition, another case initially described as probable has been ruled out and will be removed from the list. This means our total lab confirmed positive and probable positive cases in Manitoba remains at 20 at this time. Today, I'm strongly advising all Manitobans, including healthcare providers, to cancel or postpone any non-essential travel outside of Manitoba. This travel advice is regarding international travel as well as travel within Canada. In keeping with our social distancing strategies, now is not the time for essential travel. In addition, effective today and going forward, public health officials are recommending that anyone who returns from travel, including domestic travel, should self-isolate and self-monitor for symptoms for 14 days after their return. This recommendation regarding provincial travel does not include the commercial transportation of goods or services, workers, including healthcare workers who may live in neighboring jurisdictions who travel to or from Manitoba for work, or normal personal travel in border communities for essential shopping or visits to the cottages. I again reiterate that now is not the time for non-essential travel outside of Manitoba. If any returning traveler develops symptoms within the 14-day period, they're advised to call HealthLinks for assessment of the need for testing. We know that the vast majority of cases in Canada, and certainly all of our cases in Manitoba, are related to travel. This is why it's essential that Manitobans who are returning from any travel self-isolate for 14 days. I want to make it clear that this is not just a suggestion. We have this in place because the risk to Manitobans is real since all of our cases so far have been imported from travel. We are appealing to people's civic duties and public health advice to follow these self-isolation guidelines. However, the Public Health Act allows us to issue orders if we find people are not following our advice and putting the risk of Manitobans at risk. Manitobans are reminded that public health orders remain in effect at this time. The public health orders apply to public spaces, not to workplaces at this time. However, workplaces have been advised to still implement social distancing strategies to reduce the impact of COVID-19 on Manitoba. So school is out, but I need to remind Manitobans to continue practicing social distancing. This means staying at home as much as possible. Do not arrange in-person play dates with other families. Practice responsible social distancing from others. This includes not being in close contact to others, even outdoors. Going for a walk and around the block is okay, visiting a park is okay, but not crowded venues even outdoors. We need to do what we can to ensure we're all socially distancing at this point. Certainly socially distancing does not mean social isolation. Ensure we're staying connected with our loved ones, especially those at risk. We want to ensure during these difficult times we remain connected to the people we love. Manitobans are reminded to practice the 3 Ps: protect yourself, protect our loved ones, and protect your community. To protect ourselves, washing our hands frequently, avoiding touching our face, cancel or postpone your travel, and certainly don't attend any large events. Protecting your loved ones include coughing into your sleeve, sneezing into your sleeve, avoiding large crowds, and disinfecting surfaces regularly. How we can protect our community is to practice social distancing. Stay at home when you're ill, stay at home when you can for the most part, cancel events, and use reliable sources of information. We know we are not helpless against this virus. We have many measures put in place now. Manitobans are well aware of the roles that they can play And many Manitobans we see are implementing these strategies and doing their part to reduce the impact of COVID-19 on our province. I would note for the media that we are committed to full and open disclosure about cases and the progression of the virus. We are moving to a one-a-day format for our news bulletins. We've heard that the multiple bulletins released a day causes some anxiety. The schedules of getting the test results back from the lab don't always fit with those timelines, so we'll be reporting new cases daily going forward. And thank you. At this time, I'll pass it to Lanette.
Thank you. So I would like to begin today by thanking Tim Hortons, who has been delivering coffee and snacks to our testing sites throughout Winnipeg for the past several days. This morning, they were at Mount Carmel Clinic as well as Access Winnipeg West, and I understand they'll be going to other testing sites in the days ahead. We know the staff at the testing sites across the province have been working incredibly hard trying to make sure the wait times are short and social distancing measures are in effect. So we appreciate the work that they are doing at the sites, and also just a special thank you to Tim Hortons for showing their appreciation and putting a smile on the face of these hard workers. Just a report on some of the stats from our operations. So HealthLinks received nearly 2,400 calls yesterday. The average wait times continue to decrease, and yesterday was 33 minutes. Our online self-assessment tool received about 35,000 views yesterday, and overall 240,000 views since it launched on Tuesday. The French version has also been very popular and received nearly 900 views online. Community sites, 436 people visited the community testing sites across the province yesterday. So that brings our total of 4,100 visits since they opened on March 12th. Additional locations across the province are expected to open this week, including in Interlake Eastern and Southern Health. Please remember that these are not walk-in clinics. People need to receive a referral prior to going to these sites, and not everyone who is screened will need to be tested. Manitobans are asked to call HealthLinks to receive instructions as to whether they require testing and where to go. Remember, only those Manitobans with respiratory symptoms and a history of travel need to be seen at the screening sites, as well as if they've been in large events like conferences or cruises or flights. All other Manitobans are asked to stay home if they are ill. A few updates for home care. So home care workers are being asked to screen clients in advance of home and community visits. So they will be asking similar screening questions in terms of if people are feeling ill, if they have a history of travel. And this move is part of our continuing efforts to reduce the spread of COVID-19 and ensure that both our providers and our patients remain safe. Wherever possible, home care workers will screen their clients over the phone in advance of any normal appointments, but they may also do these screening questions in person prior to entering a client's home, provided that appropriate social distancing is in place. Screening will identify if there's any potential exposure to COVID-19 within the household. It will also identify whether service can safely be postponed or offered in another way, such as over the phone or virtually. If visits must occur in person as scheduled, home care workers will be expected to wear their personal protective equipment and follow proper hand hygiene protocols. I also just wanted to give you an update on our blood supply. In the last week, Manitobans have gone and donated, and we are in a much better position this week than we were last week. So thanks to all of you who took the time to donate. The one area where we still could use some more supply is for those of you who have O-negative blood. If you have O-negative blood, please donate. And finally, I just want to tell you a story that came to my inbox yesterday, and I love it. So at the Fort Garry testing site, the MPI Bison Drive location, over the weekend there was a woman who had just returned from traveling internationally, and she stopped in to get herself tested. Probably wasn't feeling well either. And along the way, the staff realized that it was her birthday that day. So once they finished her swab, the entire staff broke out in song and sang happy birthday to her. And although she probably didn't want to be in the testing site for her birthday, I thought this was a great gesture on the part of the staff to brighten her day and have some team camaraderie. So it's a great reminder that we should continue to be kind to one another, even in these times of stress and uncertainty. And so thank you to Jillian and all the people at MPI testing site. So I guess we'll open it up to questions. I don't know where they're coming from.
This is the Q&A portion of our briefing. Thank you very much, Lanette. I would now like to ask our media representatives to ask one question and a follow-up question, and to please introduce yourself as we move forward. We'll begin today with Canadian Press reporter Kelly Malone.
Hi, Kelly Malone from the Canadian Press. So there's a lot of talk across the country about expanding testing and removing some of the regulations so that it's not just connected to international travel. Are there any plans in Manitoba to start testing at a higher capacity?
We do have those plans, certainly from the beginning of our response to this. We know that testing is very important, and so we're looking at ways to increase our capacity. We're looking at ways to broaden our testing parameters. So right now we are still focused on those that are highest risk, those returning from international travel, those with symptoms of respiratory illness. We've added certain people who are critically ill will be testing as well, regardless of traveling. For right now, those are our testing guidelines, but we are looking and have plans in place to expand as our capacity permits.
Do you have a timeline for when there's expanding? There's a lot of concern in the community that, we have some of the lowest cases in the country, that's just because we're not testing to the level that we should be.
Yeah, I can speak to the concern that we're not testing as we should be, and that there's risk in the community. I can tell you from an acute care perspective, when we look at the emergency visit volumes, when we look at the bed capacity in medicine and critical care, we are at low volumes right now, low occupancy, which tells us that not that we shouldn't stop, we should continue to be vigilant, but we're not seeing COVID-19 in our hospitals at this time.
Thank you, Kelly. Next up, Winnipeg Free Press, Larry Cush. Larry.
Yes, Larry Cush, Winnipeg Free Press. I'd like to follow up on the testing and whether there's issues with at Chatham Provincial Lab. Is the lab able to handle all the tests that are being forwarded? And can you tell me about any backlog?
So they have been certainly prioritizing certain groups of tests, those healthcare workers, those who are critically ill, those in hospital, as well as those from a long-term care facility and First Nations. Those are being prioritized. They do have over the last few days, a backlog, which they are moving towards, and we're hopefully up and running at full capacity early this week.
Can you tell us how big the backlog is?
That's changing by the each run that they go. So I don't know the specific numbers right at this second.
Thank you, Larry. Next up is Winnipeg Sun reporter Scott Billick.
Hello. Just looking to, I guess maybe on the same vein of the testing, but it seems like, there's a lot of concern, obviously, about it. What can we say to allay the fears of people who, are talking about this? They want to know why they're not tested. There's different reports but people are saying, I'm a nurse, I haven't gotten tested, but I have symptoms. What is the message to people who are wrestling with that question still?
Well, so the message is that capacity is increasing. We have been doing a lot of testing. We're over 4,300 tests since the beginning of this. We've had days where we're testing over 400, over 500 samples in a given day, and that capacity is coming up back up. And so if we look at, is it likely that we have 500 symptomatic return travelers per day in Manitoba? I think that's quite a high number. So we are testing a lot of individuals, and we're going to continue to try to expand that. We have plans in place on what priority groups would we expand to next. But testing is not the only method of surveillance. We have, like Lanette was discussing, we have syndromic surveillance. We have low ICU demands right now, lower demands in hospital beds, lower attendance at ER for respiratory illness. So we follow all of these as well. In addition, our social distancing strategies are really part of the wide strategy. Testing is only one component of a strategy. Testing alone would not help us against COVID-19. We need all of our strategies working together, and social distancing, again, staying home when you're ill. If you are not tested for COVID-19 but you're sick, stay home until you're better. So we're not going to be spreading viruses that way either.
For sure. And my second question, I got one more follow-up here. Specifically for home care workers, those that are going into homes and for people that are requiring daily assistance or care, are they considered essential workers, and do they qualify for child care under the regulations right now? Or, the regulations, as like the same as doctors and nurses?
Yes, they would. There are some things that are done in home care that are not essential services, but the work of the people, they are essential workers. So we are looking at this point at identifying if we had to decrease visits because of a COVID outbreak or because of a staffing issue, what kind of things would we we must continue to deliver in terms of healthcare services. So yes, they would be included, but we are considering still if we do have to reduce, what would those be? So, and it would depend on the individual person and what their needs are.
Thank you, Scott. Next up is CBC Winnipeg's Bartley Kivas.
Dr. Roussin, Bartley Kivas, CBC here. Can you please be more specific about the nature of the backlog in terms of, is it the PCR machine capacity? Is it the ability, your stockpile of reagents? Is it your staff technician pool? Can you please go into specifics of what is holding it up and what needs to be done to get the maximum capacity out of that CADM lab?
Right now, the major roadblock is the reagent, and that is worldwide. That's in all jurisdictions having difficulties obtaining that reagent. CADM Lab has been working at actually being able to produce their own, which is why they're now getting out of this backlog and getting back up to full capacity this week.
All right. And are you looking at expanding past or outside of PCR as a method of testing? Some other jurisdictions are using other forms of DNA testing or protein testing. Forgive me a lack of technical knowledge. What are you looking at beyond PCR?
Right now, PCR is the diagnostic method of choice. There are different examples of testing coming out now, but most of them will be using molecular samples. Certain rapid testing has been approved in the United States by the FDA, but again, that won't be to market for quite some time. So the lab are continuously looking for appropriate ways to test for this, looking at ways to expand testing, and so we will leave them on that to update us if there's any emerging ways to test.
Thank you, Bartley. Next up, CBC Radio-Canada, Patrick Foucault. Patrick, are you there? Let's move on.
Sorry, yeah, was on mute. Sorry about that. Patrick Foucault, Radio Canada. All right. We've heard a few people telling us that their clinics, so regular clinics for everyday medical issues, are closing their doors. Are you aware of that situation? Is that some sort of a trend in the province?
That is not from direction from this table, I would say. So I think it's individual providers, if that's what you're referring to. They would be making the decision for their office practice.
Would there be any solution for these people if their clinics are closed? I know I guess it's individual decisions for the clinics, but is there what can you tell to these people who are concerned that their clinics are going to be closed?
Yeah, so I'm not sure about the clinics. We can look more into that. In terms of the community services, like some of the rehab services and the day activities that were provided by the system, they were looking at options to do virtually or at least have maybe smaller groups so that the social distancing could happen. So that's some of the strategies we've asked them to look into. In terms of the private clinical provider, I don't have those details, but we can maybe see what we could find out in terms of what services have been decreased.
Thank you very much, Patrick. Speaking to Winnipeg, Michelle Gurway.
Oh, if I could just also say, though, if patients aren't sure if they need services and they're not sure where to go, they should be encouraged to call HealthLinks, and we can sort out some of the issues and provide some direction.
Okay, it's Michelle Gerwin from CTV. I just wanted a little bit of clarification as to who is enforcing the state of emergency rules, so who is going to be going out into the community enforcing these rules, and where do people call if they see something that they think might not be following these capacity rules and open and closure rules?
Right, so right now it's the health inspectors that are largely being proactive, reaching out to those affected businesses and those affected by the orders to encourage compliance, to assist with advice on how they could comply. And so there will be more communications out to the public on which pathway they could connect should they have any specific concerns.
Okay, and then just another one here about workplaces. So what about like large offices that have more than 50 people working in them? Do these rules apply to them as well, or can you clarify that?
So the public health order right now applies to public spaces, not to workplaces. So the order itself is not being applied to workplaces, but the strong recommendation now, well over a week old, is that everyone should be practicing social distancing. So although there may not be an order right now in place, we are expecting all Manitobans to know their role on how they can help with social distancing strategies. So employers, we mentioned a number of times, ensuring sick workers are able to stay home without a burden. We don't want sick workers coming to already burdened healthcare systems for sick notes. We want to ensure that there's an easy way that people who have been identified for the need to self-isolate can self-isolate. Otherwise then they'll be coming to work when they should be self-isolating. Frequent hand washing, finding ways to, even though there might be more than 50 people in a workplace, finding ways to encourage social distancing, allow some workers to perhaps work from home if possible. So all of these, it's going to apply differently in different situations, but we are fully expecting all Manitobans to do their part in helping us reduce the impact here.
Thank you, Michelle. Next up is Global Winnipeg's Marnie Blunt.
Hi, yeah, Marnie from Global News. Can you just explain the logic and reasoning behind why we're putting a 1-month limit on prescription medication?
Right. So this is again related to our response to the pandemic. We want to ensure that we have adequate supplies of essential medications. We wanted to avoid an instance where there was hoarding of medications all at once. There's no need for fear or panic. We want people to be prepared for that isolation period, if they should self-isolate for 2 weeks or maybe need to be at home if they're ill for a couple weeks. But there's no need to stockpile goods. There's no need to stockpile medications. And so we initiated that to alleviate the possibility of a shortage of essential medications.
There's people who have previously had a 3-month supply for their chronic conditions, and there's concern that now they have to spend 3 times the dispensing fees and visit the pharmacy 3 times more often. What's your response to that?
So these are all things that are considered, and just with many of our orders, our recommendations, there are consequences in other aspects. So right now we moved that it was important to ensure a stable supply of these medications, but we're reviewing all of the effects that it has, and we're constantly reviewing our policies, and we'll keep that all in mind.
Thank you, Marnie. CJOB's Diana Foxall.
Hi there, Diana Foxall from 680 CJOB. Just a quick question on transit. Enforcing social distancing on transit seems a little bit difficult. How is that being done and how is it being enforced?
So right now the public health orders are for transportation facilities, so stations of the such, so they don't apply specifically to public transit. However, having the social distancing strategies in place now for a while, we see that much of that is taking care of itself. There's less people on the bus, and we're not seeing that crowding there. We will, if we do see it continuing to be an issue, then we would work with our partners at the municipalities to see how we could enforce that. But most of the strategies are in place, and we're not seeing that crowding.
Okay, and then on another note, we've been hearing that some people who kind of have private hair salons maybe in their home are still open. Of course, that doesn't seem consistent with the social distancing recommendations. What is your reaction to someone who is maybe a private hairdresser at home continuing to operate, and would there be any measures taken to kind of clamp down on that kind of thing?
So we're constantly reviewing our policies, comparing to other regions, looking at the transmission dynamics in Canada and other places. So we'll be updating our recommendations frequently. With these type of issues, we haven't had orders that directly apply in that circumstance right now. That certainly could change. But social distancing strategies are multiple. And that there are multiple levels. So certainly the recommendations for people in similar circumstances would be not to attend anyone who is showing symptoms of respiratory illness, not to attend anyone who should be self-isolating, frequent hand washing, ensuring social separation between other patrons, and just ensuring good hand hygiene are pretty good protective measures right now. But like I say, our orders are likely to expand as we see more and more transmission around us in the nation.
Thank you, Diana. From the Brandon Sun, Drew May.
Yes, hi there. This is Drew with the Brandon Sun. I know last week the province suspended all non-essential surgeries, but what's the procedure for non-essential diagnostics, like an MRI or an X-ray?
Yeah, that's a really good question. We're actually just working through that protocol now, and I should be able to give you more details on that in the next day or two.
Okay, just a quick follow-up, but with those, is there concern that people going in for a non-essential diagnostic procedure could be coming in with an illness or with COVID-19 possibly?
That's a good question. People should be screening at the door. That is one option in the hospitals and the facilities. And then also asking people just to be aware of, have you traveled? Are you feeling sick? Should you be out and about? So maybe talking to your physician or calling Health Links for what do you do if you're feeling this and you're scheduled for a test.
Thank you.
Thank you, Drew. Nabby Ball, 1029 CHBN.
Hello, this is Nabby Ball with 1029 CHTM. Last week, MKO announced their recommendations for First Nations that they serve to limit travel outside of the reserves to essential travel only. Would the province also eventually limit essential travel to non-Indigenous communities in the north as well, such as Thompson, Slimfar, The Paw?
Well, we continually review this, certainly in remote, isolated areas where, really concerned about higher risk individuals going there, so people who are requiring to self-isolate. Certainly in remote areas, we're extra cautious from that. But we have no plans right now to limit interprovincial or intra-provincial travel right now.
And in terms of First Nations and testing sites, Dr. Lavallee recommended that Indigenous communities identify their own testing sites. Are those being reported to, is the province being notified as these sites are identified and prepared?
We've been working collaboratively with a lot of First Nation groups and leaders. And so the actual testing sites, I mentioned is the testing for COVID-19 is not a new test in any way, the way to collect it. Though First Nations test for influenza every year. And so it's the exact same collection, exact same process of collecting for that. And so they can just submit samples just in that same manner, same materials, same collection technique, and just send it to the lab. So we're not necessarily going to be notified of who does that. We'll just be running the samples should they arrive at our lab.
Perfect, thank you.
Thank you very much, Nabby. Much appreciated. Let's head back to the top of the list now for a follow-up question from Canadian Press, Kelly Malone. Kelly, are you still there? And do you have another question?
Yes, can I actually just get the updated numbers, a bit of clarification on how many are confirmed and how many are presumptive?
Where now as far as the confirmed goes, I believe we are at 14 confirmed and 6 probable.
Thank you. That's all my questions.
Thank you, Kelly. Back to Larry Cush, Winnipeg Free Press.
Yes, I'd like to go back to what's happening at Chatham Provincial Lab. Often we get a number of tests done. I didn't hear the count for Sunday. Could somebody tell me the count for Sunday? And also, could you also, in as layman's language as you can, repeat what you said about what was holding up things at the lab.
Yeah, so I don't think I received the number of tests run on Sunday at CADM. We're trying to consolidate that testing and report it out a couple times a week. The as far as what's holding it up is just the reagent. So where they the swab, the material that's collected on the swab is extracted and put into this reagent that allows for the multiplication of the genetic material of the bug, and that's the process, and it keeps replicating it until it's finally detected. And so the reagent is one of the requirements for running that test. And so I don't know the exact makeup of that reagent. That's very technical, but that's what's the essentially worldwide demand on that, and every lab is facing some demand issues with that, and CADM has been able to produce some of its own, which has gotten us this far.
So would it be a key supply or key chemical?
Yeah, I don't know all the components of the reagent, Larry. They refer to it as the reagent, so I don't know if it comes all pre-made or what exactly is in that.
Thank you, Larry. Winnipeg Sun's Scott Billick.
Thanks. Just in terms of the probable cases, how do you define a probable case?
Probable case is one that tests positive at CADM provincial lab, but has not yet been confirmed at the national microbiology lab.
Okay, thank you.
Thank you, Larry. The CBC's Bartley Kivas.
Brent, Dr. Roussin, pardon me, Jason Kindrechuk at the University of Manitoba says conservatively that social distancing measures will likely be in place for 2 to 3 months. Conservatively, in your mind, notwithstanding the provincial order, how long do you think some social distancing measures are going to have to be in place in Manitoba?
Has left the conference.
Yeah, so it's difficult to predict, but if we look at other jurisdictions, if we look at previous evidence on how long these factors have to be in place to make a substantial difference, and also taking in consideration it's unlikely we're going to have a pharmaceutical intervention in the near future, then we're looking at multiple weeks for sure.
Can you define what you mean by multiple weeks? 2, 3, 10, 50?
No one can predict that. Anyone who says they know the number is guessing. So we'll need to follow the dynamics, where our thoughts were to get way out ahead of it and really flatten that curve so that perhaps there'll be ways to loosen some of these social distancing strategies. But we need to think of multiple weeks for this.
Thank you. CBC Radio Canada, Patrick Foucault.
Yes, no new questions. I'm good.
Thank you, Patrick. CTV Winnipeg's Michelle Gerwin.
Regarding the interprovincial travel, can you explain again about whether or not that's plane related, or does this also include traveling in a vehicle?
That's right. That would be, it's not related to the mode of transport. The only restrictions are those people who come in to and from Manitoba for work purposes, those who visit neighboring communities for leisure, for shopping, and then certain essential workers, including healthcare providers. So the method of travel is not really what's at stake there.
And also, just what's the threshold for expanding testing? Like, is there something that you guys are looking for in the community to kind of say, now we're going to start testing more people who don't have these certain parameters that we're looking for, which is travel and the symptoms?
Well, all of the testing issues are capacity. So if we had the capacity right now, then we could test as many people as we wanted. So we don't. And so we need to test people who are highest at risk of this. So we are testing, over 4,300 tests, but have come back at 20 of those as probable or confirmed. So even testing the highest risk individuals, we still have a remarkably low positive ratio, proportion of tests. So we're going to continue testing the highest risk. As our capacity grows, we can expand.
Thank you, Michelle. Global Winnipeg's Marnie Blunt.
Yeah, I was just hoping to get a bit more clarification on who's exactly enforcing the regulations of the state of emergency. Like if somebody sees people gathering in a group of more than 50 or violating any of the recommendations, is it the health inspector they call, and what's that number? Because what Winnipeg police have been saying is they've been getting calls about related to COVID-19. So if I could just get some more clarification on that.
It's our public health inspectors that have been reaching out, and we will be having some communications going out shortly, giving multiple streams of avenues for people to report certain issues or have certain questions. So that will be coming. As we enhance our public health orders, then we'll be engaging with other municipalities, other agencies to see exactly how our enforcement could be expanded. And again, most times having public health orders in place, regular communication, Manitobans knowing what's expected of them, almost everyone will follow those type of things as we keep going forward. But we have to have methods for enforcement, and that's what the orders allow us. And then we will and we have ways of looking into it and enforcing as well.
Thank you very much. We'll move on then. Diana Foxall, do you have another question from CJOB?
Yeah, just a quick question on daycare. Are either of you aware of any daycares that were open today for essential service workers?
It's our understanding that 85% of the healthcare workers have been able to successfully find or have daycare in place. And then we have provided phone numbers for people so that, and they can also go to their employer if they're having any challenges in getting daycare. When they have to go to work, then they can contact their employer, and we will connect with the Department of Families to make sure that their placement is a priority.
Okay, and then just a quick second question. I noticed you have switched from presumptive to probable in terms of terminology for unconfirmed but suspected cases. Is there any reason behind that?
The only reason is really keeping in line with how the Public Health Agency of Canada is reporting. They report as probable and confirmed.
Thank you.
Thank you, Diana. From the Brandon Sun, Drew May, are you still on, and do you have a follow-up question?
I am, thank you. Just a quick question, but Lanette, you were saying earlier that there would be some more testing sites opening later this week. Do you have any more information on where exactly those testing sites will be?
I know there will be some in Interlake, Eastern, and Southern later this week. And in discussion with Prairie Mountain, they are looking, their volumes are actually fairly low at the testing sites that they have available now. So they're looking at the location and the demand, and we'll work on that over the coming days. And I don't anticipate there will be more within Northern Regional Health Authority at this time, but as was discussed, the testing can be done on the First Nations community at the nursing stations, as well as the PA, Flin Flon, and Thompson.
Thank you.
Thank you, Drew. Nabby Ball, 1029 CHVN. Are you still on the line? Do you have a question?
Hi, no questions at this time.
Thank you very much. Are there any further questions? I will open it up now. Let's please try not to step on each other's toes here. And,
yes, please. Brent Roussin, your CBC. What is the hospital capacity right now, Ms. Siragusa? Can you express it in percentage terms? And What's our rate of beds per 1,000 people right now? How many people are waiting in beds? Can you give us a general state of our preparedness right now prior to the surge that we may get when the cases rise?
Well, I feel like we've done a lot of work in the past 6 weeks getting ready for this, so I can tell you we are very prepared, but the preparations are going to continue to go on, and they're getting more detailed as we go. So, yeah, so I'm just looking at my data. Was that Bartley? Bartley. So my records show that at this time there are 131 medicine beds in Winnipeg that are open, and the ICU capacity is just under 80%, which is, we don't see those numbers very often, so that's quite low. But regardless, we're looking for, in terms of preparation, looking at our baseline and making sure we use all our baseline, but also have the ability to expand beyond that capacity.
Thank you.
Larry Cush at the Winnipeg Free Press. I think, Dr. Roussin, you said earlier that all cases are related to travel now. There was one that you weren't certain about. Are you more certain now?
That's correct. So in fact, the case that we could not link to travel or could not link to any exposure was in fact the test that is now negative, not a positive result. So that was the false positive test that I mentioned earlier.
Oh, so that's the one that's negative. Okay.
Scott Billick here from Winnipeg Sun. Just wondering, are there plans in place at some point to perhaps, if this did, when it does blow up, I don't know how to kind of word that, but is there plans in place to use or to have different sites that would be built, or maybe use the arena per se, to kind of house, patients dealing with the virus?
Those discussions are underway, and we are looking at partners. We'll give you an update on that when we get some more detail. I think it's important to know, too, that the majority of people who get COVID-19 don't require hospitalization, but they do require isolation. So your question about should they be in an arena, we do have to look at ways to cohort patients who are infected. It doesn't mean they need to be in the hospital. It means they need to be in isolation. But absolutely, for those who do need to be hospitalized, we are doing everything in our power right now to look at staffing models, supplies, equipment, and space so that we can expand as the need demands.
Thank you.
Larry at the Free Press again. Is there just still one
has left the conference.
Is there still just one person in hospital?
Well, in fact, that one individual has now been discharged. So we don't have any of our current cases hospitalized.
COVID.
May I ask one more?
Sure.
Bartley Kivas here, CBC. If dentists or the construction industry wish to donate masks that are N95, where could they do so?
We have a 1-800 number. It's on our Shared Health webpage, but I can get that to you, where we are working with partners and accepting donations for supplies. Kevin's going to send that to you, Bartley.
Thank you very much.
Larry Cush at the Free Press again. Are you rethinking the number of folks that you're allowing to gather in groups? It's under 50 now. Are you looking at a lower number?
Yes, so we're continuing to review our social distancing strategies and the public health orders. So it's we are having plans in place to escalate some of those orders, and one of them will be that number of people allowed to gather.
and what number are you looking at?
We're still reviewing other jurisdictions, still reviewing what we think will work here based on our outbreak. So more to come on that.
Is that it for questions this afternoon?
Can I ask just one more, Kelly Malone, sorry, Canadian Press, just one more clarification question. You mentioned that the person that had the false positive test, just trying to update my spreadsheets here, but can you give us a little bit of idea of who that person was? Because that day it came out, we got a cluster of people, man, woman, age range.
It was a female. I don't know offhand the age range on that individual. It was an individual that we were unable to link to travel or to contact to another case, and so that now has been removed as a probable case.
Thank you.
And sorry, just one, just a follow up to that. Sorry, Scott Bill, Winnipeg Sun. How did you come to that determination? How did it get to that point where you're able to, I guess, conclude that it was a false negative?
Right. So the test performed that makes it probable at CADM lab had came back at a very low level positive. We were unable to get a confirmed test at the national micro lab. We then retested the sample at CADM. It was again negative. And then, in fact, the delay was that we went out and tested that individual again, and that retest came back negative at CADM lab. So based on all of that, we've determined that it was not a positive test the first time around.
Perfect. Thank you.
Michelle from CTV. I'm just hearing that people are calling HealthLinks and they think they have all the symptoms and are reporting them to the person on their line, and they're being told, like, even if you have it, don't go for a test. Why would that be the advice?
That's right, because the symptoms of COVID-19 are the same symptoms as the flu or many other respiratory illnesses. So we are linking the high-risk individuals who have COVID-19 with testing. So those who are contacts to cases or those who have returned from international travel. So that's where our capacity is to test right now. The advice is, if you're unwell, stay home. And so the issue of spreading infections, even if that's a different type of viral infection, it's still dealt with in that manner. If you're sick, stay home. If you have mild symptoms, stay home. If you have traveled internationally, if you're a contact to a case, then certainly we want to test. But even then, we're seeing a very low proportion of our tests, even in that group of individuals, coming back positive.
And can you tell me how long the wait is for a result for your test now?
Oh, I'm sorry?
How long is the wait to get a test result?
Yep. So we had to, because of the capacity due to the reagent at the lab, we had to prioritize certain groups that I mentioned: healthcare workers, people who are admitted to hospital, long-term care facilities, and such. People with mild symptoms that were tested those tests might have been a few days. We're hoping that moving into this week, we're going to get that back to the 24 to 48 hours.
Thanks.
Thank you very much, Michelle. That wraps up our session today. Thank you all for participating in our briefing, and we will continue to.
Patrick Foucault, Radio-Canada.
Thank you.
As left the conference.